Good afternoon, guys. I've got discussion A for you this afternoon. We are talking about how nurse practitioners are tackling the mental health crisis in primary care. Okay, so that is discussion A for you today. Here we go. As the mental health crisis deepens across the US, nurse practitioners are or nurse practitioner NPs are stepping into a pivotal role, especially in primary care settings, where behavioral health needs often surface first. The page outlines how MPs are the not only filling the gaps left by a strained psychiatric workforce, but also transforming care delivery through innovative models, expanded scopes, and culturally responsive strategies. Expanding mental health capacity in primary care. MPs are increasingly the first line of defense in identifying and managing mental health conditions. Their contributions include routine mental health screening and early intervention. MPs now routinely screen for depression, anxiety, PTSD, and substance use disorders during primary care visits. When psychiatric specialists are unable, they initiate treatment using evidence-based protocols such as SSRIs or for depression or brief cognitive behavioral interventions. Psychiatric specialty MPs, which is PM HNPS. These advanced practice nurses provide full spectrum psychiatric care, including diagnostic evaluations, psychotherapy, medication management, and crisis intervention. Their presence in primary care setting, their presence in primary care settings helps reduce bottleneck in specialty referrals and ensures continuity of care, task shifting, and role expansion. NPs are managing cases that previously required psychiatrists. Specialty mild to moderate conditions. This task shifting accelerates access to care and allows psychiatrists to focus on complex or higher acuity patients. Integrated care models and tools. MPs are driving the adoption of integrated and collaborative care models that blend physical and behavioral health services, collaborative care teams. NPs work alongside social workers, psychiatrists, and care coordinators in embedded behavioral health teams. These models improve communication, reducing stigma, and allowing for more handoffs between providers. Stepped care and, and measurement-based approaches. NPs use standardized tools like PHQ-9 and GAD-7 to assess symptoms and track progress. Step care algorithms guide treatments, acceleration, assuring patients receive the right level of care at the right time. Telehealth and remote outreach. Telepsychiatry and virtual consultations allow NPs to reach patients in rural or underserved areas. These tools are especially vital in regions with few mental health professionals, establishing timely diagnosis and follow-up, systematic barriers, and equity challenges. Despite their growing role, NPs, nurse practitioners, face structural and policy-related obstacles. Workforce shortages and referral bottlenecks. Many primary care practices lack reliable access to psychiatric specialties, leaving NPs to manage complex cases without adequate backup. Scope of practice and reimbursement issues. Some states NPs face restrictions on prescribing or independent practice reimbursement for behavioral health services in primary care remains inconsistent, limiting the sustainability of integrated models. Rural and cultural discrepancies, geographic isolation, transportation barriers, and lack of culturally competent care make it harder for marginalized communities to access mental health supports. NPs often serve as trusted providers in these areas, but need more resources to tailor care effectively. Policy, solution, and innovation. Okay, the page highlights several strategies to strengthen NP-led mental health care. expanded mental health training for MPs, increasing access to psychiatric certification programs, and continuing education ensures more MPs are equipped to handle behavioral health needs confidently. Support integrated care funding models. Policies that reimburse team-based care, care coordination, and behavioral health screenings can make integrated models financially viable. Scale teleconsultation and hub and spoke models, programs that connect primary care MPs with psychiatric specialists for case review and mentorship, help build local capacity and reduce professional isolation. In summary, nurse practitioners are not just filling gaps, they're reshaping how mental health care is delivered in primary care by blending clinical expertise with community insights their for they're foregoing a more accessible, equitable, and responsive system for patients across the country. Okay, guys, so that is A for you. I will be back on shortly with B. I'll see everybody in a few for B, please, and I'll be back on with you. For now, Gator Wellness, take care, folks.